Thank you so much. Uh, I'm gonna check if anyone in the chat has a question. Um, sorry, I'm trying to figure out how to do this. I think you can ask to unmute yourself uh and then ask your question, and then Courtney, do you want to help me see like if people have questions in the group? Or yeah, let's get the discussion going. Who wants to ask the first question? Go ahead, Daisy.
This is really awesome.
Can you hear Tanya?
It's pretty hard. So if somebody
wanna
could just
come up.
speak into the mic or
Yeah.
come up and say hi.
If you guys have a question, just literally come up.
Where's the mic?
I just talk in the computer.
Oh, right. Okay. Hi, my
Hi.
name is Daisy. Yeah, this was really great. I loved hearing about all your work and really interested in diving into it further. I was just curious what your thoughts are on, or if you've done any research associated with more of the kind of like visual aspect of like experiences and or other features of what, again, within this Western conceptualization of like psychosis or schizophrenia, spectrum disorders, like cognitive difficulties or things like that. I was just curious if you had any thoughts on that or research.
So, as you know, there's no settled understanding of why persons develop schizophrenia or bipolar disorder, or I mean, schizophrenia in particular is everybody believes there's a biology, but nobody can agree on what it is. It's pretty clear there's a diversity. But I think many people think that the condition that we call schizophrenia that comes with cognitive disorganization, you find that everywhere. So we know that that condition seems to have a better prognosis at least in India. That's where the best data comes from. The visual question is really interesting. I think that I am persuaded that many people have um, sensorially richer experiences than the word voice suggests. And that my sense is that when people use the English word voice, it can sort of mute the sensorial richness because they're listening for the voice rather than paying attention to the visual richness. So in Ghana, people spoke pretty comfortably about visual stuff. In India, where people are always using the word voice, English word voice, they did not so much. And in the US, people were not talking very much about the visual richness. I think the other thing that's kind of cool is that it used to be said that the madman hears and the shaman sees. So the person, the religious expert who is not ill sees, and the person with psychosis hears, and that's not true. So if you look across the general population of people who are religious, you see, sometimes, and you just can't, say how often do you, I mean, it's pretty imperfect, but hearing and seeing hallucinations are kind of running neck and neck.
Thank you.
Yeah, I'm sure that I'll try to focus on one. Hi, Professor.
there.
Thank you so much for your presentation. I have a few questions for you. I'm someone with lived experience who's had intense acute episodes as well as ongoing experiences of hearing voices, perceiving, and seeing. I'm very curious if in your studies you've come across people who have had acute or intense experiences that that incorporate all of these different
Yeah.
cultures, because with such a globalized world and the mixing of medias, especially, and the access we have through television, internet, what have you, to be exposed to different cultures. I'm someone who's been fortunate to get to travel in my upbringing, and I'm very, very curious if you found other people who may perceive that they're going through this shamanic initiation, this training with the Yokomfu, or these things. What do people typically report is being accomplished in these episodes or these acute experiences? Because I feel personally like there is a lot of work that the interceder can do if this person is an intercessor, if we want to call them that, the shaman, what have you. What have you found them reporting about? I know I just threw a lot of things out there, but like, what have you found them reporting about their calling, maybe? And is there a difference generation to generation that you're noticing?
So there's a lot I don't know. Those are excellent questions. I do think that you might be interested in this sort of new literature on these spiritual crisis.
Mm-hmm.
So there's this like work by Jules Evans and Richard Sackville West, I think that's his name. And there sometimes they call it spiritual emergency. And so in a secular context, it's hard to know what to make of those experiences because and people just don't know what to make of them. In religious settings where the religion has room for ecstatic or unusual experiences, people are a little more comfortable. So, I mean, that's obviously the case in Ghana. I think it can be the case in Chennai, depending on the community. Um, it can be the case in rural China. So if the local culture has a category, then the person has sort of the option of understanding themselves as going through a spiritual crisis.
Thank you. I've heard that term before. I've had mentors explain it to me that way. Thank you. Other questions?
Does anyone on the Zoom have any questions? Let me see. Um, I think if there's a way, allow participants. Okay. If anyone has a question on the Zoom, feel free to unmute yourself and just go ahead and ask. But okay, we'll get the next question. But I just, of course, go. Okay. So this was very interesting to hear considering I'm a neuroscience student and I also have lived experience and, kind of what helps me is like I'm using neuroscience to interpret my own experiences. Um, so I don't know, I was just kind of thinking, like, I had a question about what you thought about like that, lens of framing psychosis is like a biological phenomenon or and then
Yeah.
I also have a question. Because I'm not in this anthropology, so I didn't really understand what uh phenomenology
Oh,
experience.
phenomenology. I'm sorry.
Yeah, I didn't know what you're talking about.
Okay.
And I was also curious, like, you like, I don't know, just because I really like doing, statistics. So like, how do you objectively measure like the vividness of these experiences like on a scale and find like
Um,
statistical significance, like I guess like how are you like I'm kind of curious about like how you make claims like, like how do you objectively measure in Russia that the accounts contain more like folklore elements or just I don't know, it's just interesting because
yeah.
goes to the
So I mean, so I live in a world where I'm looking at people's subjective experiences. So I've started to collaborate a little bit with people who use neuroimaging devices. It turns out that the tulpomancers, you can show that when the tulpomancer possesses the body, the brain looks a little different. Like the supplemental motor cortex does a little more work.
That's what I'm studying actually, that cortex.
Very cool.
Yeah.
So, so that does a little more. I'm not sure if I may
It's
have
a
misspoke.
cortical.
It's the supplemental motor cortex, and I think it changes its activation pattern, and I think it does more work rather than less work, but it might be the reverse. But it looks different. That's what I'm confident that we know. When to measure, we ask people questions, and then if it matters, we count. So in what persuaded the PNAS to publish our comparison was that when we did we had the open-ended interview, there were like two different people doing the conversation, and we have a pretty set structure of questions to ask. They were doing lots of follow-up, lots of exploration, but there were some set questions.
Mhm.
Have you ever heard God speak to you in a way you could hear with your ears? Phenomenology asks about experience, and what they were looking for in the way people answered that question was some trace of a hearing quality. So people would say, well, what do you mean by hear it with your ears? Hear it with your ears. Did you turn your head to see who was speaking? Did you feel that it was outside of your head? Did you feel that it was, or was it more inside your head? And so there was a chunk of text. So they're having the interview. Person is talking. We transcribed, translated those conversations, and we got to like something like 30 questions. And the field worker is looking for the subtlety, but also making a very blunt judgment. Yes, no, did they have this experience? Did God speak in a way they could hear with their ears? Did God speak in a way they felt in their
Sorry, can I
mind?
interrupt you? Why can't you use like self-report measures? Like I guess why I'm just kind of curious what the point of like having a person objectively like make, that I don't know, I'm just curious like about that.
So, I mean, we also gave people surveys and said, fill out the survey. Tell us whether you've ever had these experiences.
Mhm.
And so we sometimes dropped them off in dormitories and picked them up. Sometimes we handed them to people and they circled things. And I mean, one of the challenges, and the reason the PNAS published it, which is a good place to publish such a paper, is that there was a relationship between what happened when we spoke to people and had these conversations, and when we had
Mhm.
short conversations, and when we gave people a survey and they filled it out on their own. One of the things that's complicated in talking to people about vivid faith experiences is that you get this mixture between what you might call the ideology or their culture, or what they want to be true. And I've said people have a lot of ideas about God. And sometimes people will say, well, God spoke to me, but they don't actually experience that. They're sort of talking loosely. And sometimes it's a very vivid experience. So
Mhm.
when you have a conversation, you can sort of begin to ferret that out.
See, I think the field of neuroscience can learn a lot from, this field and from people like you, to inform, I don't know, better research practices and methodology. And, it'd be so cool to have, like, for example, like, I don't know what the person's called who, runs these interviews, but to, incorporate like these, like interview subjective, I don't know, I can't pronounce the word, like,
So,
and
so
phenom I can't even. And just to like also integrate like, for example, like
Sorry, I missed the last piece
no,
because there's a plane
I'm
overhead, but
all I'm saying is this field can learn a lot from a person like you, and it would be cool to have both perspectives blended more often and not have them be such insular worlds. So thank you.
so you should do that. There's somebody here at Stanford who's a young MD PhD, and she wants to create a sort of phenomenological neuroscience. And so she's quite interesting. And so if you stay in neuroscience, you should think of doing that. So Neb Jones is a big fan of doing that. Cordelia Erickson Davies is the person at Stanford, big fan of doing that. These people that I hang out with in studying voices, there's something called the International Consortium of Hearing Voices
I know it.
Research.
Yeah.
No, it's hallucinations. Sorry, the International Consortium of Hallucination Research. And that's exactly what they try to do. They try to combine these more experientially oriented ways of thinking with more neurosciency ways of thinking.
Okay, thank you so much. I'm just gonna, if anyone has questions, feel free to unmute yourself or put them in the chat. All right, let's get someone else.
Hi, it's me again.
Hi.
I was wondering, given all of your research and all of your experience and everything, I have a PhD in clinical psychology, and so I feel like we often kind of think about like, okay, what can we learn from this? How can we apply it, right? And help folks. So I'm just wondering, I mean, I think a lot of what you were discussing about the group in Ghana, I kind of wrote some notes down and something I've been thinking about, that we don't engage with the voices enough in treatment in the US, right? I think folks are kind of just like scared of it and kind of try to shoo it away and throw medication at it. I was wondering if you, again, given all your experience and everything, if you had any thoughts on how all this information that you've learned could be like applied, or we can learn from it in terms of like interventions for folks, whether it's, someone with a full diagnosis, or like we study folks at clinical high risk for psychosis. And again, given that in the US, like you mentioned, they often are a bit more distressing and a bit more violent and difficult for folks to cope with. One thing I was thinking about is, like you were saying, engaging with it, trying to kind of like have a relationship and see what is kind of like um going on there, and like maybe some positive um kind of motivations for the voices and things like that. But I was curious if you had any other thoughts, or yeah, stuff about that.
That's great. I mean, I do think that the hearing voices approach is pretty interesting. So it's sort of treated as radical in the United States. Ipi Kalafnos over in the VA is doing some of this work, so it would be great to talk to him. But so at the minimum, the hearing voices approach says, figure out what the voices are saying, and be interested in the voices, interpret that, help the person to understand that these experiences can be meaningful. They're clearly, they carry, they're important to the person who has them because they can be quite significant. I also really like Eleanor Longden's TED Talk. She's one of the things that the early psychosis world that's interested in voices says is that it may be true, and I'm sympathetic to this point of view, that the way people come to understand their voices in the very beginning may shape the way the voices are experienced farther out. And my guess is, because it's super hard to prove this, is that the one of the challenging things in the US is that people are often very quickly afraid of their voices. Um, I, it's complicated because sometimes, the voices are telling people to do terrible things, and they shouldn't be doing those things. I mean, that you don't want to do those things. But if it's, possible to, so the hearing voices approach asks people more about the voices, and it asks people to talk to their own voices. The avatar therapy approach does something that's similar to hearing voices in that it tells people, you should let your voices know that you're not worthless. Think of something that you did that's not worthless, and you share that with your voice. And then you and then in avatar therapy, they're practicing that with the therapist and a computer simulated voice. In the hearing voices group, what's happening is that people at the minimum are talking about their experiences with other people, so they're a little less afraid of them. And they are recognizing that at the minimum, they're recognizing that people, often have similar experiences. That's often shocking to people because they sometimes feel so alone when they're early on in this experience. I mean, I'm guessing that people would have that might or might not be true of everybody in this room, but sometimes people feel terribly alone, and just being with other people who have similar experiences can be helpful. Sometimes when they're in such a conversation, Mary realizes that Susan has a technique that Susan uses, and then Mary can begin to use that technique. And sometimes in the hearing voices groups, the facilitator will explore different techniques, find your most important voice, make sure that that voice has a name, and then try to negotiate, to figure out what you're learning from the voice. I mean, Eleanor Longden and I hope this is not too much detail, but Eleanor Longden, when she talks about what her experience was, she said that she learned to treat what the voice said as a little more metaphorical. So if the voice said, um, you know, don't leave, don't go out, she would say, oh, I'm figuring out that this voice thinks that, has picked up that I'm afraid of going to this meeting. And I thank the voice for this information, and I tell the voice that I think I'm going to be okay, and that I'll be back. That's not so easy to do for everybody, but to some hearing voices groups will say, well, you just begin to have a conversation with the voice and see if you can persuade the voice to you name the voice. See if you can persuade the voice not to show up during class. So you so begin to I'll listen to you before dinner, or and you need to be careful because sometimes the voices are saying really mean things, but that's sort of the invitation that would come out of this kind of world.
Mhm. Yeah, no, thank you. One thing you were saying that it was a question I was going to ask, but then you kind of addressed in your talk, which was, yeah, it sounds like maybe for folks with kind of earlier experiences or maybe less intense, um, it might be easier to kind of apply these things. And I was wondering what your thoughts are for folks who maybe have struggled with this and it's been really stressful and not helpful for years. But then, the group in Ghana, like some folks have been, experiencing it for years, and it seemed to still be able to bring a lot of folks some kind of like some abilities of like control and managing it so that it's a bit less kind of distressing. So that was really cool. Anyway,
I
thank you.
mean, one of the things that, of course, is that the experience of psychosis is sometimes very intense and sometimes less intense. And so, what people learn when the experience is less intense, they can begin to apply when the experience is more intense. And in my experience, um, these techniques, people learn them at any age. And of course, when people hit their 40s and 50s, the experience is modulating anyway. But it's, people join these groups at all kinds of times. Um, and sometimes it's true that if something settles into a pattern, it can be harder to change the pattern. But I've seen it work for people of all ages. And some people it doesn't work for at all.
Thank you.
Hey.
Hi there.
My name is Reagan. Nice to meet you. Thank you so much for doing the talk. It was very, very informative and it was
Oh,
really
good.
wonderful to hear from you. Um, I had a question somewhat related to the one that was just asked, but more from kind of like a clinical-esque perspective. Um, I was wondering that, do you find that people, I know you said you visited hospitals, that people who maybe are just starting to experience symptoms of psychosis or hearing visions, hearing voices, seeing visions, often like ask for explanations of their experiences. And if they don't align particularly with a cultural perspective or like a religious perspective, if there is a like perspective that you can give them that helps them understand their symptoms better and maybe helps them like work through them better and is overall like more productive for the person and their experience, if that makes sense.
So, yeah, it's a great question. I'm not a clinician, so I feel uneasy giving clinical advice. But I think all of these new approaches, like the avatar therapy, compassion and acceptance, the new CBT for psychosis, hearing voices, all of these techniques, begin with the perspective that these experiences are meaningful and worth trying to know about. And so I think the simplest observations is asking people what they're experiencing and then trying to help them understand what is meaningful to their lives about that. Or does it carry information tell them things that they're afraid of? Does it tell them something that they might have experienced when they were younger? It's, the religious interpretations are both, it's not, religion is both a wonderful thing for many people and sort of not so great for many people. And sometimes people will get, caught up in the idea that a God is talking to them and then the God gets meaner and meaner. And then that creates its own problems. But at least helping people um, recognize the experience. And again, I think getting people to talk to each other may be helpful.
Wonderful. Thank you.
Welcome.
Josie also just wanted to point out, we wanted to let you know that Ippy is actually going to be one of the speakers in our speaker series. If
Excellent.
at all interested in attending, we are more than willing to send you the information for that.
Great.
Thank you.
Okay. Hi, Professor. Nice to meet you. My name is Nalia. And thank you so much for giving this wonderful talk. I wasn't here for the entirety of your talk, and I did come around the time when you were talking about, I guess, the impact of like evangelical religion on the like connotation of voices that people hear. And I was wondering in like the US group where most people heard like negative voices, were any of those evangelical or only atheist or like non-practicing? And like does like spirituality or like more specifically like Christian and Catholic religion impact like a US like Americans like
I say that again?
or does like Catholicism or Christianity or like evangelical religious ties does that affect like did that affect like any Americans connotation of the voices that they heard?
So I was pretty struck that most of the people in my American sample were religious, and many of them heard God at some point, but God was not um, but God just wasn't one of their most important voices. I would love to talk to a more people who were charismatic Christians and who also met criteria. and I haven't done that yet.
Mhm. Oh, okay. Okay, that's fine. Thank you.
Thank you.
All right, the person who organized this event might have a question for you. Okay, she doesn't. One more question from you. Oh, sure. What's up?
Does anybody else want to ask a question?
I'm just gonna ask. So we only have a little time left for questions. So first, I would like to ask any of the participants on the Zoom if you have a question. Now is your opportunity before we have our last in-person question. So I don't know how to work Zoom. Let's see.
You can remove pin in the upper.
Okay.
Remove pin.
Oh yeah.
See if anyone's waving.
Kate or Sean, you're the last people here. Do you guys have any questions? Okay, we have our last in-person question. And thank you.
Hi there.
Hi again. Hi. Um, I know you're not a clinician. I guess I'm curious about the future of your work, what you're researching now, and if there's any particular pressing question you've come up against that that seems unanswerable thus far in your work.
Oh, so many. I think the next thing I'm going to look at is the spiritual but not religious community and the way, and some I'm going to try to look at spiritual emergencies. But I'm really intrigued by, what am I intrigued by? I don't know why people hear so many commands. That's really interesting to me, why there are so many commands. I don't know why um, when people, um, I don't know, I sort of can give you a hand-waving answer to why the mind is full of people, but it's just so striking to me that people have these audible experiences of minds relating to them. Like people tend, and the voices are so focused on them. That's just interesting to me. That, nobody ever says, that's not true. Sometimes people, that people overhear other people talking. But, mostly certainly when people are religious, they're having an audible experience. It's a command. And that's quite interesting. I don't know, it's people, it takes a lot of work to be able to experience God talking to you about a tuna sandwich. Mostly when people experience God, it's like, go, come, do. So there's something really basic about the human mental experience of hearing commands.
Hmm. I'm curious about that one detail in what you said about why there are so many voices in that
Yeah.
someone might hear in the mind and why they're all around one person. It makes me think of two things, collective consciousness and a question of whether you've come across somebody who holds their framework around experiences where they might have a certain cosmology that explains the many levels or categories and structures, organizations to this like labyrinth of spirits, if you want to call them that, or just forms, streams of consciousness that people access.
Yeah. Yeah, no, people definitely. I mean, I think that what happens is that um, often, not always, is that people start having compelling, unusual experiences and they need to explain them. And so then the explanation, I think, sometimes holds the experience in place or changes the experience. But it's, often the world, what people talk about is the world changing and then having to make sense of the change.
Mhm. Okay. Well, thank you so much.
You're welcome. Thank you.
Thank you.
Yeah, thank you so much, Dr. Luhrmann. Yeah, I think we're gonna wrap up, and I'm sorry for going a little over your time.
No, that's fine.
But yeah, thank you again, and we'll send our other club events because yeah, Ippolitos is speaking also. So in case you want to join,
Great.
I'll send that to you.
That'd be lovely.
Okay.
Great.
Thank you.
Bye-bye. Thanks. You're Courtney, right?
Yeah.
Yeah. Thanks, Courtney. Take
Bye.
care. Bye-bye. Great questions.